that signal as an indicator of the frequency and the amplitude, and it is very subjective. All of the literature on horses involving EMG that has come out of Europe in the last few years, there's been 3 or 4 papers. All of them are probably mostly hogwash, because they do not recognize in those papers that horses have, when they stand, their muscles are essentially at rest. So they measure the amplitude. So in humans, if I want to do an EMG on a person, what I do is I take you, ask you to relax, put the needle in, listen, how much amplitude, how much frequency, then I ask you to contract as hard as you can, and then I measure that. Then I take the difference between the two. In the horse, can't do that. But they are basing their publications upon that concept, so I consider their work invalid. But their name is in the paper and mine isn't. So we want some loose skin to put our ground.
Are you videotaping? Will you just...
There's someone will hang on to this.
See, only I would say, Lou, you may need to put a hand switch on him.
Yep.
Depending on how he responds to the...
Sedation take effect yet?
Yeah.
You sure?
I'm likely the one you kick, so I'm pretty happy.
No, my knee still hurts, okay? Let's see how it responds. So this,
that's what we'll have to figure out.
this doesn't hurt, it's the fact that something is, we can turn the volume off like that. You turn it on, you touch any button. So it's the skin stimulation that he's feeling here, it's not painful. He just thinks it's a fly. So be prepared to kind of run with him. Yep. So this very small needle, it's Teflon coated. Tip is your electrode, it's hollow, you eject through it. So find midline, and we're going to go towards the back of the radius. So put my finger here, find the midline. And for the most part, it doesn't hurt. So this is the muscle activity when the muscle's at rest. In the background, that really intense click, those are going to be the motor end plates closest to you. Now for reference, what I want to do, he's being real good. While we've got a moment here and he's quiet, over here on the front. Are you recording?
Do you mind if I do?
No, you can do anything you want.
Thank you. Because I'm only going to remember 2% of what you said.
Okay, so this is the more normal foot. This is one with the normal x-rays, right? Let's get out of here. Two, and then turn it down.
Gotcha.
So I'm going to see if you'll let me go into the extensor compartment as comparison on the same legs. So we're just going to, can't touch any button. So that's what we would expect.
I see.
Okay, there's the flexors. Now they're still going to maintain some tone. And you can see there is some. Let's turn the volume. Volume's all the way up. Oh, sorry, no, it's not. It is.
Okay, wow. Substantial difference between the flexor and extensor there.
Right. Now we would expect the flexor, because it maintains a standing position, to have a click, click, click. But all of that was way, way too much. Okay? So if you want to touch the two arrows at the same time, let's go back into the flexors. You ready? Yep. And try not to hit on midline. I'm going to go more lateral. So I'm going to be more in the superficial flexor this time. And just hit a button. So he's actually got sustained contraction of the superficial and the deep, the 2 points we've looked at. That's just in the superficial, and then just go deeper.
Sure, makes sense.
So would you hear a greater amount if you was to lift the opposite foot to where they were using full pressure on that side?
Yes, you do. Yes, you do. So this is, again, a subjective thing where that's why we're just taking our time and listening and looking. This is abnormal tone. Again, the background, the loud, intense click is what we want, not all this other stuff. So,
Easy.
I'm gonna hold on to that, yes. These needles get bent up, yes.
Yeah, I think it's right though, something, but still. Then go surprise them.
Oh my gosh.
All right. Wait a minute. These will dry out and stop conducting water.
Sure.
Okay. So you relaxed enough that we can go back in? So
I think so. We'll find out.
we've described going 10 centimeters, blah, blah, blah. Just take your hand, lay on the elbow, and just stay off the midline right there.
Right.
Go toward the back of the radius. And if you hit bone and back up just a tiny bit, you're going to be in the deep.
You're there. Okay. Great.
And this is where a lure lock works nicely.
Do you want this on or do you care?
Let's turn it on. It's back. Oh, listen to that. Okay, so we're going to put in half a cc. I'm going to come out a little bit. And I'm going to go centimeter below.
Right.
And I'll put in a half cc. And that's superficial. So I think we should just blast the superficial as well, right? I mean, we're right in the skin. That's hot.
Right.
Let's go a half cc. And I'm just going to slide under the skin.
Right.
And go down.
Pretty direct.
And go another half cc. Pull out. Let's get down a little lower. You notice there's no bleeding. If you can figure that one out. Do you see any blood at all? How does that work?
That's weird.
So we were here. Now we're going to go here.
Mm-hmm.
Heads up so he didn't run back and hurt. So there's hot. That's really hot there with that. Let's go here. Okay, we'll turn the volume off. Let's get another syringe. You want to do this one?
Sure.
Sure. Absolutely. So I've now gone here
Here. Right.
and here.
Here.
So you need to pick a spot here and then somewhere just kind of redirect. I'd like to put a little maybe, you feel the tone of this ulnaris lateralis right here? Feel how hard that muscle is?
Yeah.
Kind of like to put a little bit in there too.
All right.
But it's not necessary. It's a much smaller compared to the others.
Mm-hmm.
The bottom line is where it makes noise is where we want to be.
So midline.
Stay off midline. 'Cause
Stay off
you
midline.
don't want to hit that fascial plane.
Sure, it makes sense.
and potentially hit a nerve.
Yeah.
In?
Go deep first? Yeah, and
I usually go deep first, just right on in. Okay,
okay, yeah.
okay, hang on, you're in fascia, so there's
Yep.
nothing going on, so either go further in or pull out. Nope, pull out, try pulling out, we're in a fascial plane.
Yeah, it's just, because it's gonna be more superficial, or not,
How about there? There's a good spot,
yeah, half?
half cc. And then just find you another spot, just redirect and go.
I'm sorry, dorsally or approximately distally or laterally?
Yeah, you need to go up, go approximately.
Reasonable or keep
Yeah,
looking?
give them a little.
All right, pull back or
You can do anything you like, just use the rest of that syringe and
in this location? Or we're gonna move up too? We're gonna
I'd
move
go
up too?
right in here, I'd just go up a little bit and
Gotcha.
let him have it.
See what that comes up like. Decent, right?
That sounds good.
You see why you want the lure lock, makes sense.
Yeah, see if you can slide straight on in, see what it sounds like on the back. Right,
Yeah.
yeah, that's fascia, so it doesn't do any good putting Botox there.
Right,
You need to hear lots of activity.
okay. You go up again?
Yeah, I would, yes. That seems fairly good right there.
The one we're superficial now, I'm sorry. Inject or redirect?
I'd redirect,
Thank
that's,
you.
that's pretty quiet.
Yeah, gotcha.
Oh, that's good right there. And where you're positioned, that is the deep flexor muscle there.
Okay. Now, do I want to come out laterally?
No, the ulnaris lateralis, I generally don't worry too much about it.
Okay.
If you hit it, it's okay, but I don't target it.
Now that's more superficial. Try that or not? Sorry.
See if you can find a little bit hotter spot. I
Okay.
know this is very subjective.
I'm not lighting up quite like you were.
Okay, then move to another location.
Okay.
So that sound that you just had is more of a normal sound, or is it
Yeah,
still?
just a little crackling and in the background, click, click, click. We hit some pretty hot spots up
Yeah,
further up the
higher,
leg, so
yeah.
might want to move up there. And
Okay, just gonna ask about that. Yeah. Yeah, sorry, son.
Will you do equal amount in both legs, since the right leg is the more contracted leg, or will you do more in that?
these both legs are equally effective, in my opinion. We're going to find out when we do the EMG on the other side. Keep going.
Keep going in.
Yes. Wait, hang on. Yeah, that's a good spot.
It's probably gonna finish me. Is that okay? Or I have sort of 7/10 left.
Yeah, put it in there.